I participated in many sports in high school and college and was interested in treating athletic injuries. That's primarily why I chose orthopedic surgery as opposed to other areas of medicine. I chose to do my fellowship here in 2002, 2003 because I was interested in surgery of the shoulder and knee, and it was a good fit for me. I had such a great experience here with all the surgeons at ISK that I chose to stay on, and this is home for me. We have world-renowned fellowship-trained surgeons in every area of orthopedics, shoulder, elbow, knee surgery, foot and ankle. And again, we deliver the highest quality patient care. We're devoted to research. We perform state-of-the-art procedures with the most advanced techniques in orthopedics that are out there. I specialize primarily in sports injury to the shoulder, knee, and elbow, as well as arthritic disorders. Arthritic disorders, specifically of the shoulder and knee, can be very debilitating, and sometimes joint replacement procedures can vastly improve a patient's quality of life and get their life back for them. I see all sorts of patients, recreational athletes, from high school to college to professional, throwing athletes, patients that participate in racket sports. The majority of my practice is shoulder surgery. Relax, let it go loose. Does that hurt right where my thumb is?
No, a little more forward of that.
Right here. More common things I treat are injuries to the rotator cuff, injuries to the labrum. Patients usually when they get into their 40s and 50s do develop a lot of rotator cuff problems. So I think the source of your pain is coming from your rotator cuff, which is a series of 4 tendons that inserts out here on the ball part of your shoulder. And the source of your pain is because it's either inflamed and swollen or the tendon's torn. So this is a front x-ray of your shoulder. Your rotator cuff that we talked about is a tendon that lives in this space here. You can't see the rotator cuff on an x-ray, but it inserts into the ball part of the shoulder joint itself. This is another view. In this space in here is where your rotator cuff lives, and that's why I would suggest we get an MRI to evaluate the soft tissues of your shoulder, as your x-rays are normal. I perform all arthroscopic approaches to fixation of the rotator cuff, which is better for the patients. The patients go home the same day. They recover quicker. I also perform a great deal of arthroscopic surgery in other areas, treatments of AC joint disorders, labral disorders, as well as treatment of arthritic disorders of the shoulder, total shoulder replacement, as well as reverse total shoulder replacement. A patient-centered approach means that you need to recognize that every patient you see is different. Every patient's needs, every patient's complaints, every patient's desire to get back, to return to a functional level is different, and you have to take that into account, not just have tunnel vision as to what their pathology might be, but you have to treat the entire patient, the entire scope of their problem and their needs, their occupation, and their activity level. When a patient is finished with being under my care, I hope that I return them to their expected functional level, and that involves intimate conversations with the patient about what they expect, managing their expectations, and communicating with them. Hopefully at the end of their care under me, they're back to the expected functional level, pain-free, and performing the activities that they want to perform.